Happy to be with you and grateful to be able to present the information on the poster. I see that they got it pulled up there. I'll let you, this is actually the one for tomorrow, so we'll take that off and you can just listen to me. I have a poster on the Global Burden of Disease 2010, which was published in Lancet in 2012. And there are several major findings in this study, which is the first systematic review of data since 1990. It involved around 500 scientists, the World Health Organization, multiple universities, and about 50 countries. And some major outcomes were the following. And the first time in the history of the world have there been, are there more people living in urban areas than in rural areas? More people are overweight than underweight, and more people are dying from non-communicable diseases than from infectious disease. And it's the first time that's ever happened. And so there are a lot of implications for that. One is that the communicable diseases are cardiovascular disease and stroke, cancer, diabetes, and chronic respiratory disease. When we look at the risk factors associated with that, they are tobacco use, unhealthy diet, physical inactivity, and the harmful use of alcohol. And one of the things that we can see here is that many of those factors are, you can reduce your risk by affecting your behavior. And so social epidemiologists are really going to be onto this, I think, in helping us try to alleviate some of the burden of the disease. Another thing about the statistics is that they have included in the Global Burden of Disease 2010 the years of life lost due to premature mortality, years lived with disability, and then combine those two in what's known as the daily or the disability adjusted life years. And the calculations for that are out on the poster, so you can take a look at that. But what's interesting is that there's a lot of debate about how the daily was calculated, and I have on the poster some pros and cons to that. But I think some of the major outcomes that we'll see focused on it in upcoming years, and certainly I'd follow the Lancet and other publications that are focusing on this study, is that we see people are living longer with more disability, and that will have a huge impact on funding, on health policy, and on what you and I do every day and where our focus should be. So I think it's something to pay a lot of attention to. So the poster is just basically a special interest poster, and so I'd be interested in hearing your thoughts about it. Thank you.